Well, good morning, and thank you, Richard, so much for joining us today. I'm really excited about this conversation that we're going to have about ways to help nurses in preventing burnout. And so just as a quick introduction, I'm Wendy Morgan, and I'm the CEO and founder of Shift. And we're a training and technology company that we focus on this well-being work, but we also go through a lens of addressing equity and mindfulness, and we use virtual reality as a tool to achieve those things. And I would love for the viewers, to introduce yourself and your work and how you came to this space of preventing burnout.
Sure. Well, thank you so much for inviting me. I really appreciate it. I'm an author now, a nurse author. I started writing the book when I was getting my doctorate, my DNP. The volume kind of kept growing and growing. And when I brought the manuscript to the publisher, she said, "Richard, you have to break this into 4 books. There is just so much here." Yeah. And originally I wanted to call the book Healing Burnout in 365 Days because I have a daily lesson and it's a 1-year journey. But because we broke the book down into 4, I went with the Healing Burnout Guide. So.
Yeah, I like that name. I like the term healing and that approach. I know we're hearing a lot from nurses right now that calling them resilient and saying we need to help you be more resilient is really almost hurtful, because it's the organization that needs to be resilient and they need help with healing and rebuilding their compassion. It's something that they give of constantly. And so you were in nursing for a while. You were bedside.
Oh, yes, for quite a while. Yes. I started out in 1997, March of 1997. I was a vascular surgical nurse on FAR 9 at Beth Israel Deaconess Medical Center. I was there for a few years, and then I transferred into the acute dialysis program. They also had a chronic program. Was there during a merger when Beth Israel and Deaconess merged. It was an exciting time to be there. The program, however, was outsourced, and that's when I began a travel nurse career.
Oh, okay.
And so I said, if I'm going to be a travel nurse, I'm going to travel far and wide. So I ended up traveling to 14 different states.
See a lot.
Yeah, I said from Maui to Maine and back again.
And depending on the season, right?
Yes. I became a weather weenie. So going from the Northeast to the Southwest, I did that, for quite a few years. And then in 2008, the economy was very poor for travel nursing because of the crash. So I decided, well, maybe I better go back and get into management and go back and get my master's degree. So I landed a job at UNC in Chapel Hill. Mm-hmm. Wonderful organization, taught me so much while I was there. And I went to Pfeiffer University and started the MBA program and did all my certifications while there. And then I ended up going to San Antonio for a while because I have a great love for pediatric dialysis. Mm-hmm. And I was there for a couple of years. And then I went back to Seattle Children's Hospital for almost a year as an interim. I've been doing interim leadership positions since then. When I was finishing the MBA MHA, I had 1 course left in my healthcare administration program. And that's when I decided to do my doctorate in nursing.
You just can't get enough. Well, that's amazing because you have so many perspectives on this issue that's facing us now. And that has put you in a very unique position to help. I love that.
It is. And I sort of, in my books, I'm drawing upon each discipline to really help pull things together for folks. Mm-hmm. I looked at 365 different perspectives. I didn't necessarily agree with every perspective.
Right.
But I included them because I felt like it was important to include them.
Yeah.
And then, of course, I had a dear friend that I went to school with 30 years ago who was an art curator, my friend Nancy. And she helped me get 30 volunteer artists together. And we paired the prose with each page.
Oh, wow.
To make it a really beautiful experience, a year-long experience, a journey for recovery or prevention.
Mm-hmm. Yeah, that is important. We hope to help on the front end and not have to do so much of the recovery. I'd love to talk more at first here about that pairing of alternate things. I mean, typically when we think about preventing burnout, there's, here's the steps you take, and here's this, and you got to do these and take the classes. But I don't think that we value enough bringing in things like art and prose and in that. And so that this first piece, I'd love to talk about, why did you choose that based on your personal experience with nursing and the burnout there?
Well, I wanted to, there were so many people writing about burnout, and there's a lot of different information out there about it. Wanted to be clear in, understanding these different perspectives. So I did a lot of literature review in my clinical hours that I needed for my doctorate. And the things that interested me, I clipped. Then I sort of drew upon my MBA in leadership and change management to write the self-reflection, personal development questions in response to the perspective. And many hours I spent at Westfield Public Library with my friend, who's the curator there, and she's also a librarian. And we paired the work, the artist pieces with the prose. When she would suggest a piece, I may not have agreed.
Yeah.
When I suggested a piece, she may not have agreed. But when we agreed together on the piece, that was kismet, and we knew it was going to work. And so that was our process.
So when we look at today, what's going on, I mean, I know that none of the issues facing nursing in the field of nursing are new, but the degree, the magnitude of what's going on is new. There are techniques, therapy, things like that. But I know when you're really burned out, when you're down in the depths, having someone say to you, eat less junk food, go for a walk, do yoga, your reaction is, I don't want something else to do. Don't tell me another chore. I want those potato chips. So what are some techniques that you wrap into your work and that we could look at that give back to the nurses instead of telling them to do something more?
Well, the whole series is about doing work on your own, tough work on your own. So many nurses are very busy because they're working so many hours. So I wanted to offer something for them that they could do at home in the quiet space, of their own mind and their own environment. And so that's really what the book is about. And that's the gift back to nursing for everything that it's given to me. Yeah.
So when you were at Bedside, did you use some of those things, or did you think, today I wish I had, and thought of some of these ideas you've incorporated?
When I was a busy traveler, going back and forth across the country and packing my bags every 13 weeks with 3 dogs in tote, no less, and driving here and there, it just became a lot. So the techniques in the book are primarily about journaling, right? And I became very fascinated with Dr. Virginia Berninger's work at the University of Washington. She's a professor emeritus. I've never met her, love to, but apparently she put subjects under the functional MRI, and she asked them to type, to print, and to write in cursive. And apparently, when they wrote in cursive, it lit the functional MRI all up in all sorts of different colors.
Oh, wow.
And so, having a past experience in art and graphic design and photography before I became a nurse, that really, sort of excited me. And so I wanted to incorporate that into the book as well. Having hobbies, I know you talked about resilience and yoga. They are key terms in the word grit. And yes, some folks do feel that resilience is sort of a hot topic. I already was resilient when I graduated nursing school or medical school, right?
Right.
And now you're, sort of blaming me. And I'm not really to blame here about these processes and how things evolved over time.
Right.
So let's fix the problems and, action plan our way out of this. And so that's part of what the book is about. Also, I ask the reader to do a lot of action planning. And the real homework in the book is actually answering the questions. Ideally, I would love it if folks did it in cursive. You can still type or print if you want.
Yeah.
But if you see the covers of the book, I actually include cursive on the cover. That was the reference to that. So.
Yeah. Well, in today's age, of course, we are always looking to technology, right? How can technology solve our problems? And me, even though I'm the founder of a technology company, I say to use it cautiously. So virtual reality is the space we work in, and it is a very powerful tool, whether you're talking about the implicit bias work that we do, because it's labeled the empathy machine, or behavior change, which it's great at. But with great power comes great responsibility, right? So if you've got this powerful tool, you need to use it properly, but then also apply that properly, because technology is not the be all end all. It's not going to fix everything. So, and in your work, have you encountered, aside from the MRI scan, have you encountered using technology to address some of these issues?
Oh, I've seen the development of technology over the years, from paper charting to electronic medical records and, every different type of software application in a hospital, multiple cities and organizations. So I've seen that evolvement. As far as technology, I devote one page to it in my book, and it's about being a double-edged sword, right? That we do need to handle responsibly. And for nursing, my concern is that nursing is such a hands-on discipline that with technology, we get further away from the hands-on and are doing more data entry type of work, where, nurses, I think the great concern is that they want to spend the time with the patient. They want to use nursing to their full capacity to care for people in every domain of their being.
Yes.
And many times in acute care, we compartmentalize and we take care of just certain things. The mental health, the emotional, spiritual well-being of patients is sort of sidelined. And I think that's a big frustration for nurses, because that's, big why we want to be nurses. We want to do those things and care for people in those domains.
Yeah, it's like the other care professions, if you will, those that you go into because you have a passion for the outcomes. It's teaching, nursing, all these things. And that one-to-one interaction is a crucial piece of what gives back to nurses. So when you look at automating things, making sure that you're not putting barriers between that desire to care for people by people, but somehow augment that or give back in a way. And so are you familiar at all with the use of the virtual reality? Have you used a headset before?
No, I've never, that is not my domain.
Yeah.
I'm interested in it, in the use of it though. Because the newer generations in nursing, I'm sure very open to it and are probably adept at it. I don't, someone from my generation, might be a little bit more challenged, maybe, possibly. I'm not going to say that there isn't anyone in my generation that, couldn't do virtual reality, but I think, absolutely, I'm on the computer reading all the time about different things. I was reading about physics and quantum entanglement the other day. And so I was curious about quantum entanglement and how that relates to virtual reality. And
Mhm.
so I don't know, maybe you can help me explain that.
That's definitely a complex world. So with this,
Yeah.
there's of course many facets to every problem. And so we talk to some CNOs now or even nurses and everyone, they're like, oh, well, if you could, cap salaries or these things or that. But, those are big overarching goals that are going to take a huge movement. But looking at it from the perspective of, say, management, what are some steps you feel like could be taken to build these resilient organizations where well-being of nurses is a focus?
Sure. I mean, that would go back to my DMP project. I don't know if you're familiar with Cantor's theory.
No, I'm not.
Cantor's theory is really great because it talks about how you're going to retain employees, nurses in particular, or not actually the nurse work-life model did that, which is an expansion of Cantor's theory. But those two theories I looked at in my DMP project, and I created assessment tools for managers in all the different realms, the different factors regarding retention. I would love to see my tools implemented in an organization. Managers, middle managers could be doing spot checks with these tools and do immediate action planning, on the spot action planning for each of those different realms. It's kind of tough to talk about it and not show it to you, but it's published and it's in the Sigma repository.
Oh, okay.
For folks if they want to look there. So that's what got me interested in burnout.
Okay.
Because my project was in retention of dialysis nurses. Mm-hmm. And so when I was doing literature review and I kept typing in the word retention, the word burnout was a key word that kept coming up. Mm-hmm. So I decided to look at that as well.
Yeah. And to me, it seems like it's going to take a collaboration of everyone within a unit to help do this. And one thing that we keep talking about and hearing about is empowering nurses to be able to say no. So it's like, oh, can you float this shift? Can you just put a few more hours? Can you make this phone call? Can you cover my patient? And, again, these care professions, and I can speak to that. My first career many years ago was actually in teaching. And it's the same thing. It's that we love the word yes. Yes, we can help. Yes, we can make a difference. And that we don't reach a boundary where we learn to be comfortable with saying, no, I can't. And it is of utmost importance that I look out for my well-being so that I can say yes to coming back tomorrow. Have you heard this? Is this an experience? And then what could management do to empower people to be able to say no?
The book is about setting limits.
Okay.
That's an interwoven theme within each of the books. So yes, setting limits is very important in nursing. Mm-hmm. Because we are givers and we want to give. We'll just give. The cup needs to remain somewhat at least half full for ourselves, right? Mm-hmm. It's very hard to say no for nurses. It's very difficult. That's a very challenging question for me because I'm a yes person, right?
Yeah,
I always have been. I don't think I've ever said no, you know? And so you've hit me.
So maybe I like to use the term flipping the script. So maybe instead of how do you say no to others, how do you begin to say yes to yourself? And so that's yes to I must go home now and not take extra hours because I know I can feel that I'm beginning to burn out. And if I say yes to myself, then I don't have to say no to others because I'll have more to bring to the table.
Right. That also is very tough because there's mandatory overtime, right? And so sometimes nurses don't have a choice. Sometimes they have to stay. That can impact their self-care. Yeah. A great deal.
Well, it is definitely part of the conversation is how do we negotiate and my apologies to the system, but the very antiquated system that is healthcare right now. And while also beginning to really focus on honoring humans and the human need for self-care and wellness. And so, we can't just keep going on as machines. And so that is why I really like to focus on the work of mindfulness, because mindfulness is about in this moment, because we can get very obsessed with how do we fix the whole system? How do we change everything? How do we overhaul it? How do we do all these things? But what we really need to do is say, in this moment, what is something I can do for myself to be grounded in the moment, or to give myself a shot of energy that can get me through this shift?
Okay.
Momentary actions would be.
Well, in the book, there's a page on Nadi Shodhana Pranayama, and it's nostril breathing. Right?
Yes.
alternate nostril breathing. And I have a dear friend from California who's in the book, and she on Facebook did a video, and she teaches people how to do that. And that's something you can do in 6 minutes.
Oh, wow.
To yourself. And you can do it seated in a chair to have deep relaxation. And so I firmly believe in Nadi Shodhana Pranayama, because it helps me center when I'm all over the place.
Yeah.
It's a centering exercise.
That is a good one. So one thing that we're thinking about doing with the virtual reality is building scenarios where you can, as a nurse, step away when you have your break, and you can go to Hawaii or to sit on the side of a lake in the mountains and have that time where it's guided breathing. But you can completely leave behind the reality that is, where you're working or what you're dealing with in that moment. But it is all centered around that breathing. It is astonishing to me how much we breathe improperly as humans, and how much of a difference breathing properly can actually make.
We don't exhale. We're more of inhalers, but not exhalers.
So if I were a nurse and just working all the time, and you're like, oh, we just need to breathe better. From you having been a nurse, what do you think the reaction would be to that?
Go take a hike.
So how do we get through? I mean, because, we want to help, but when you are overwhelmed, help sometimes feels like more work.
There's lots of cynicism, right? And so we have to break through that cynicism so that we can, be open to learning and open to different ways. When you become so cynical, that's just steps away from being totally burned out.
Right. Yeah.
And I think with so many healthcare providers and professionals being burned out, I mean, what are the rates? Now I just read 60 to 80% now post-pandemic.
How do we present working with nurses, the help, like the work that we do and many, many others, and you? How do we get through where they are, where burnout, unfortunately, causes cynicism and a lack of wanting to get help?
Well, I can speak for me, and, what I can offer, what I see is my work being interwoven into the organization, either through email or through an application that a nurse can log into and do their journal entry. But that has to be private. And so, there's some concern there. Those are journaling moments for that nurse. There's also group things and group exercises that can be done in workshops. And I'd like to see my work develop that way. In fact, I have a workshop written that expounds upon the book series.
Yeah.
I would love for these things to be delivered daily to nurses and everyone in healthcare, because the book was written for everyone. Primarily nurses, because I'm a nurse, but I would love that. And, if they got these messages and perspectives, did just a little bit of quiet time, 5-10 minutes to themselves before the start of their shift,
right,
or at the end of their shift or mid shift to recharge, that really might be some, food for their soul. I would love to see that occur with my work.
Yeah. And, as we were talking about earlier, it is hard to set time aside, because it feels so, especially now, feels so frantic. But it is amazing what even, we say 5 minutes, 10 minutes, and that maybe that feels overwhelming, but as a place to start, even 90 seconds. We were talking about the breathing, if you can just step away to a quiet space for 90 seconds, and then you can still have the rest of your break to go eat cookies, but you at least are doing this one thing that has a little more longevity to the positive impact.
I think it's hard for nurses to find a quiet space on the nursing units. I mean, they can't even find a place to drink water unless they go, to the break room down the hall and around the corner. And if they don't have coverage and the call lights are going off, it's just, there are very challenging things occurring in the culture that have happened for so long that it's just reached a tipping point. We just got to action plan our way out of it.
Yeah.
And I know it can be done.
Yeah. So talk a little bit more then about the action planning. I mean, what would that look like for a nurse to do some of that now?
As far as that in the workspace or in the home space?
I'm referring to the workspace at this point, because that's the focus really is.
I think to action plan with other nurses, they really need to get together. And there needs to be more unity with nurses. In my DMP project, I noticed when I gave the questionnaire and the survey, half of the nurses would vote one way or answer the question one way, and the other half would answer the other way. And so it's almost like there's opposing forces in, how they respond to questions. So I think we need to bring that to light. And with that in mind, then really work on a way to coming to consensus. We've got to have consensus in order to make the changes that are needed. And so I think first building consensus with your groups in your units is so important. And then you can really, dive in, and whether it's a lean process, maybe you need to move the water fountain, in the nursing station. Maybe you need to put plexiglass all around the nursing station so that you can have drinks in the station. Maybe the bathroom needs to be moved so that, it's, easier, for the nurses to access. Just, there's so many different little things that could be done that need to be improved that make it very hard for the nurse to be at work.
Yeah, this is so multifaceted. Of course, we must focus on the nurses that are currently working. And I'm wondering, what are your thoughts on potentially some of this training around self-care, mindfulness, breathing in the schools as we train the nurses?
Oh, I think it's wonderful. I think this should be integrated completely into, the curriculum in each different course. It could be integrated, addressing each of the, different coursework. With technology, things are changing so quickly, and I can only see the benefit of it as long as we remain being able to have hands-on and, that double-edged sword that I mentioned, right? And are aware of that.
Yeah, it came to my mind when you're saying how they need to, come together and consensus and then techniques that are already habitual. It's like, of course, we want to make sure that we bring as much of that as possible to current bedside nurses. And also now there's so many new graduates that are needed. If we embed that in nurses as they come into the field, that ability and willingness to come together and have consensus and self-advocate and be willing to use the yes, I will take care of myself terminology, that seems like that could be a great addition to caring for our current nurses.
Oh, yes. Nurses, every healthcare worker needs to take good care of themselves, especially, in the current environment. I do see hospitalizations going down and mortality going down as the vaccination rate improves. But nurses and physicians and allied health have been under tremendous stress and fatigue. And they already were before the pandemic.
Right. Yeah. unfortunately, something like a pandemic can exacerbate all of the little micro flaws and make them into canyons and rifts that feel insurmountable. But I know, I mean, for us and also for you, it's a work of passion. We've got to keep at this. And yes, there are obstacles and there's lots of why it can't work. But if we all can come together and try to at least begin moving the needle towards how do we empower self-care and wellness as a key component of this profession.
Yes, absolutely. If you can't take care of yourself, how can you take care of others?
Mm-hmm.
Right?
Yeah. And hopefully this grassroots approach then can begin to impact the politicized, the bureaucracy, the juggernaut that is the healthcare system. And hopefully we can influence change at a higher level, the decision-making level. So that would be wonderful.
Yes, it would.
This has been a wonderful interview. Do you have any closing thoughts, any last things that you would like to say?
I'm just so appreciative, of the invitation and to, allow me to get the word out about my book and how it can help nurses and all healthcare professionals in the quiet space that they have, whether it's at work, on their break, or at home.
Mm-hmm.
The art, the perspectives, and the personal development reflections will nourish them. And I'm so happy to be able to turn this doctoral work into something really meaningful that can help nurses tremendously.
Wonderful. Yeah, it is so great to hear about the work that you do and these interviews that I'm doing. It's top of mind for so many people in so many different parts of healthcare. And that's very encouraging to see that we're all getting together behind getting this done. So
yes,
it's a way to make a difference. Mm-hmm. Absolutely.
Yep.
Well, thank you again.